question that we had last week right at the very end of the program that I promised that we would get to about a picky eater. So they write in and say, "Hi, Dr. Doreen. My son, aged 9.5 years now, was a very picky eater from 1 year until 4 years. We put him on a GFCF diet for 2 years and then added that back. Now he is eating so well. He had constipation till 6 years and now is completely fine without any meds. Apart from this, he has had no other gut issues. All along, I encouraged him trying new textures, eating more, etc. However, now he tends to overeat and is slightly overweight. He keeps asking for more, and when he is really full, he does not stop." I have this problem.
We all do.
However, I have a feeling that he still overeats. Any tips would be greatly appreciated. I'll be taking notes too. I am considering testing him for diabetes or thyroid or anything else, but his pediatrician keeps telling that it cannot be diabetes as he is gaining weight and he is just being less active and eating more. Please let me know your thoughts. Thank you so much. And I miscalled it a picky eater. And I make light, but it's a very serious issue when our kids start to overeat and put on more weight.
It is, because it's very difficult to address it with them. Now, unfortunately, I just don't know the level of functioning of this child and how much you can kind of explain things to the child. But, first of all, when we eat too much. So we're past the kind of picky eating phase, so we're not really going to go into that whole question or area of feeding. But it seems like this child is using food as a reinforcer, obviously, and many of us do, but
I'll raise my hand.
But overeating, I think, if I was to just kind of analyze it quickly on the spot right now, I'd say it's a combination of using it too much as a reinforcer and then it becoming a habit. So let's try to see if we can break both of those in this case. So using it as a reinforcer basically means that he needs other areas that are more reinforcing. So you have to find other things that are more rewarding to the child and try to increase those in the child's schedule or life. And make sure they're available, and so that he can turn to those instead of just the taste of food. Then in terms of trying to break the habit, I would say, well, there's a million different techniques you can use for this, but depending on the level of functioning of the child, here are some ideas, I guess. So you limit the time at the meal. So if there's a buzzer or something and it goes off, then after that nobody's eating. You have to be careful with that because sometimes our kids or anyone would tend to speed up, and if they speed up in order to finish what's on the plate, and then that is not going to have any positive effect, so that won't work. But if you can, just what happens is people sit around a table for a long time and then they just keep eating whatever's on the table. So another way to limit that, other than setting a time on it, is just to limit what's in his plate. And basically, those are the only things that you can eat, what's in your plate, and then the overeating doesn't happen. Obviously, the overeating could also happen during outside of meal times, and I think the healthiest thing to do, and I have a few lessons as I'm saying this for my own kids, but the healthiest thing to do is to only allow snacks at specific hours. I mean, generally speaking, Shannon, what I've learned nutrition-wise is that the healthiest thing you can do is to eat approximately every 3 hours.
Okay.
So, and of course, the ones in between the main meals are supposed to be slightly smaller, but they don't really have to be. You're supposed to eat 6 times a day small meals, but we've kind of made that into 3 because we don't have time.
Right.
But if it was possible for this child to maybe make a chart of your breakfast, and these are the things that are allowed, snack, and then lunch and snack, and then dinner. It's kind of important to do that because most of our kids enjoy and appreciate some sort of regulation, so like a chart, a list, rules, you know, things about like what you can eat and what you can't eat.
Right.
And those types of things might help, because then, you know, once you hit the, like let's say you have the breakfast and you have the snack, then you want to make sure the end of every meal, the other reinforcer is available, so that we're able to so he's able to switch over.
Right.
Again, I just don't know the functioning level, because if your child's high functioning enough, at a point you can simply just go into nutritional facts and explain to the child that you need to have, you know, this much protein and this much carbohydrates, and these other things can be added to it. But it is a very hard thing with kids. And, you know, we say increasing physical activity will balance things out, but the truth is increasing physical activity really only just balances the weight. I mean, physical activity is great, but overeating itself can have serious side effects, like, as you mentioned, diabetes and other issues too.
Absolutely. And it really, it strikes me, because now that I'm thinking about it, this is the exact same age that my child is. And it's been interesting to me in the last couple of months. We tend to cycle at different times of the year where my child is a bottomless pit. He just is hungry all of the time. And, you know, I sort of feel like a hypocrite, because I'm trying to give him the best possible healthy choices. I don't always make the healthiest choices for myself, but one of the things that I've noticed is that he'll go through a period where he's a bottomless pit, and then we have a period where he shoots up, where he literally, two sizes he grew in the last month.
Right, and I'm so glad you said that, because, you know, I assumed, and I wrongfully did assume, that this is a child who's overweight, and that's why mom is concerned. You know,
I don't know. I mean, she says she's concerned about that. I don't think that's. I don't think you wrongly assumed anything. But
the truth is, you have to be aware of those growth spurts, and it's very, very common with kids, where they will eat, and then suddenly get taller, and it's all balances out again. My kids went through that multiple times, but at the same time, I just think that, I mean, that's one aspect of it. The other aspect of it is that we tend to give a lot of love through food to our kids. And that's something we have to be very cautious of.
Yeah. And what I was going to continue to say is that he did shoot up, but I was concerned because he was just wanting to eat so much. And just this last weekend, for our, as you can only do in Southern California, for his Easter egg hunt, it was at a swimming pool. Hundreds of kids, and they would age group them together. So I could see all the kids who were in his age group, and I noticed that in the younger groups, the kids were all mostly very slim and very active, but in his age group, I noticed that weight was more increasingly an issue. And that greatly concerned me, and I thought, oh my goodness, what if one of these times he doesn't shoot up after one of these spurts where he's a bottomless pit? So great advice.
Well, it's just because stress increases for our kids as they get older. I mean, they have so many pressures on them, both academic and otherwise. And so the more stress they have, the more they are going to reward themselves with food.
Okay.
And that's really, that's the main habit to break, is just, you know, food is supposed to be nutrition and sustenance. It's not reward. You know, and that's so important. I know.
That's a mental shift for me. Okay. But great advice of explaining it to them, because I don't think it was explained to me. And we had Julie Matthews with us last week, and or it was 2 weeks ago, I guess now, she brought a different food pyramid than the one that we see online. It was very interesting. We all spent a little time in the office here going over it, going, wow.
Really?
I don't think, and I know if anybody's interested, they can find her food pyramid at nourishinghope.com. Very interesting. It was very educational for me, I have to say. Okay, let's continue on to, this was another question that was sent in last week, kind of a devastating thing. My son is 3 years old, nonverbal and autistic. Over the weekend, we had some pretty significant changes happen within our household. The first one, his sister and 3-day-a-week caretaker moved away rather unexpectedly. The second thing is that his father was asked to leave and is no longer living at the house, leaving it just the mom and the child in the house. I have had to scramble to find arrangements for him while I continue to work full-time to provide for us and stay in our home, as well as figure out how to get him to and from school, as I do not trust school buses. I'm happy to say that with the help of my amazing family and friends, we have a new schedule for my son son starting this week, but my question is this. What can I do to help ease my son into his new routine? He and his sister had an amazing bond, and I know not seeing her is going to affect him. I also know that not seeing his father all that often is going to affect him as well. How can I help my son to make these changes not so traumatizing for him?
Wow.
It's a lot to have happen in a very short period of time.
It's a lot, yeah. I feel really bad for this mom. She's going through a lot, clearly. Well, okay, so the answer to that is kids, especially that young, just adjust. They adjust to things. So you don't really have to worry about acclimating him to the changes per se, but I would just say you need to be aware of the fact that this is going to be a period of time for him where he will not feel as safe. So he'll have more anxiety. And that's where you can make some change or, contribute to making sure his anxieties are lessened. So don't worry about, him acclimating to not being around sister or dad. That'll just automatically happen. To make it more comfortable, just try to give him things that reduce his anxiety, which means obviously spending time with people he knows, family members or you, doing a little bit extra things that he really likes to do, maybe watching the movies that he likes or whatever it is, just, increase the rewards during this time frame. Just keeping him engaged, just things that will naturally help him feel safer, more content, more, confident. And if you can do that for a period of time, then he'll, within a week or two, he'll adjust.
Okay. Yeah. Kids are so resilient. It's amazing.
They really are resilient. And we never have to really worry about their adjustment to new things. It's just taking care of them and making sure they're not anxious during that time, because I'm sure that for this child, it's a bit of a change.
Absolutely. Absolutely. Yeah. Great advice. We have somebody just wrote in on the live feature. By the way, somebody wrote in and reported about the food issue, that it's everybody in our country, which
I agree with that.
I agree too, that it's certainly pervasive. But someone else has said, hello, Shannon and Dr. Doreen. My child, 6, is pulling down her pants and panties in front of her classmate and laughs hysterically. She does it every time she can. I believe this all started once her pants were loose and fell down, and we reacted surprise and fastly pulled them up. Now she thinks this is a game. She does it at school only, never at home, not in the streets, but I need a functional replacement. I love that you guys are using this term now to stop this. She has an 8 at school. Any advice? Thank you.
Yeah, so that's actually terrific. Let's analyze that one together.
Okay.
So it only happens at school, and I would have to assume that it only happens in front of the other kids. So if that's the case, we could make the jump that the function of this is attention seeking from the friends, and she's not differentiating. Our kids at some point don't understand the concept of embarrassment. They just see it as attention. So like she's not necessarily differentiating that the kids are making fun of it versus, giving her positive attention. In other words, she's not differentiating between positive and negative attention. So first of all, if she has an 8 in school, that cycle needs to be broken. So this is called blocking, obviously. So, and since this is a long chain behavior, it's not an instantaneous, like the minute that she starts to do this, the aide can very simply stop it. Okay. Right? And she can just say, nope, come on, we're going to do something else. And then the aide will be able to pull her and do some incompatible activity, something else that occupies her hands so that she can't do this, and so on. So someone has to be on her in order to prevent this from happening. And if you prevent this from happening, that particular behavior will extinguish. However, since it's an attention-seeking behavior, you have to replace it with a more, let's say, appropriate and practical attention-seeking behavior. Okay. So she has to have a different way to receive the attention of the friends or the peers. And that I can't really address because I don't know. I just know the age of the child, very young, I think. 6. So really, that has to do with perhaps Perhaps it's even enough if we're able to engage the same kind of reaction from just the teacher. Because you can manipulate the other kids, that's going to be very hard to do. But perhaps on a schedule, the child is scheduled to, let's say, go to the teacher and show something, some object that she or he has created, let's say some aspect of homework, whatever, and the teacher then is surprised and delighted and gives reinforcer, and you do that on a what's called a non-contingent schedule, so you do it periodically during the day. That way the child's receiving more attention for something appropriate and just not being allowed to do the inappropriate thing. And that's always how you break these habits. So it's like you put the behavior on extinction so that it can't get any kind of reinforcer, but you replace it with something else that has the similar function and gets the reinforcer. Now, I don't know, I may have analyzed the whole thing because I don't know the child. This is all based on the assumption that your child's doing this in order because what they get out of it is that attention from the peers or from the teacher.
Right.
And if that's the case, then all of that would work.
Is it possible that there'll be a little bit of an extinction burst for a period of time that she'll be trying it a little harder? Yeah,
thanks for bringing that up. So normally when we extinguish something, it gets worse before it gets better. But since we're blocking in this case, then, you know, she might make an attempt to do it more frequently, but the aide has to be very good at not allowing it to happen.
And it sounds like what's absolutely key here is making sure that she's got some other appropriate way of seeking attention that's equally as reinforcing to her.
That's right. And you know, once she gets into the habit of finding other things, or we get into the habit of giving her other things that are giving her attention for, then you can do those frequently, and you can do those, like you block the behavior, and then you can engage her in something that's going to get her appropriate attention at that time. So it's a matter of finding the thing that she's able to do that's more appropriate, that will get a reaction from people.
I have to say that the more I learn about ABA, the more I think of it as a creative art. Because it's not a one-size-fits-all. It's everything is different, and you have to think outside the box, and it becomes like a logic problem in your head of, okay, how can... And I'm so glad that they asked this question, because a lot of the time when our kids are having difficulty in schools, not all the time, but a lot of the time, there is that attention component that they get from the other kids.
Oh, definitely.
And that's hard, because you can't, as you said, you can try to manipulate the other kids, but you really can't control that many children.
That's right.
And their reactions.
That's right. And you know, it's just difficult for our children. At some point, like at some point of functioning, we do teach our kids to differentiate between like people laughing at them and why is that something they don't want to do. You know, we start to go into that whole realm of you know, you don't want to do this because other kids won't want to be your friend. Just when our child is able to understand the whole concept of friendship and, you know, why they wouldn't want to be. But I don't know with this child where we're at. So the easiest way to get rid of any behavior is just to kind of put it on extinction or block it, and then at the same time replace it. And it's because it only happens at school, and the beginning of the email, I think that the mom wrote that it's happening in front of the other kids. I really think it's maintained by their surprise element or something like that. And you know, since it started, I think, at home with everyone kind of being shocked, then you could really try to give her that surprise or, you know, wow or whatever with some other behavior. You just need to bring that into the game.
But I have to say again, two things that I love from this question that came from this parent. One, that you started to put together, okay, what was happening before? What reaction could it possibly have been?
Definitely an ABA mom.
And that more and more we're getting people asking, I need a functional replacement behavior. I just love that. Very exciting to me personally. Wonderful. And they further wrote it and said, what word or phrase can we use when stopping this so we don't sound so negative? When they're blocking, is there a word or phrase that they might use? Or is it better to say nothing?
Exactly. I'm so wonderful that follow-up question, because that really shows how much this person understands of ABA. I love that. No, you don't want to even address it, because saying some sort of word or phrase That's a negative kind of word or phrase in itself, is attention giving. So no, you don't. You physically block it and you move on. You just don't.
Okay.
You prevent it from happening and you just move on.
Okay.
And then, you know, to help, I suppose you can practice this is kind of called overcorrection. So overcorrection is you're sort of practicing the reverse of this behavior in another lesson. So you can practice the whole dressing thing, or pulling up pants, closing belt, closing button, that sort of thing, if you're also right now teaching dressing skills.
Okay.
But you know what, Shannon, it's amazing. It just occurred to me as you and I were talking about how this mom really gets the language and understands what she's looking for, which is fabulous. It just occurred to me that this, you know, these are the strange influences, I suppose, of the increasing numbers of autism, you know. And if you look at how many families are now affected by autism, and even if we can only get to a small percentage of the families, look at the knowledge and understanding that moms, I mean, I guess for our kids, we learn everything. We do anything that we have to do for our children. And so, you know, the fact that our kids would have something like autism, and then so many parents learn the language and the techniques of behavioral intervention, that has a huge effect just on society going forward. I mean, if you learn how to change other people's behavior, if you learn how to understand other people's behavior from these paradigms, behavioral paradigms, it's going to have a very positive effect on just the universe, you know, people as a whole.
Yeah.
It's kind of interesting.
It is interesting. You know, I mean, there's certainly a lot of strife that comes with autism, but whenever there are benefits, I like to look at them and acknowledge them and say, all right, well, if this is where we are, then here are some benefits that come with it, right?
Absolutely. I mean, like, once you learn all this stuff, you yourself I'm sure would agree, you don't look at Jem's behaviors the same way. It's not like you look at a behavior occurs and you don't think, oh, this is a bad behavior I have to punish.
Yeah.
It's completely out of your paradigm now. It's more about, like, why is he doing this? Okay, this is probably what's maintaining this behavior, and this is how I have to deal with it, right?
Yes.
And just imagine if those principles apply to our daily lives.
Yes.
Right? So someone cuts you off and honks their horn or whatever, and you think, probably this person is doing this because in the past they've done it and they've gotten rewarded by it, or they're late, right? You know, and we start to look at things in life a little bit differently as a whole.
And it's interesting that our son is at the point now where he understands enough that we can use some of these terms with him. We got a dog. Yeah. And the dog's behavior, because she was a rescue dog and she came from I don't know what bad circumstances, and we've had to do a lot of behavioral therapy with a dog behaviorist with her. Yeah. And in the beginning, Jem would say, you know, the dog's being bad. And we started talking about, no, it's her behavior. She's not bad. She's engaging in behavior. She's trying to tell you something. Right. And so now he's started to talk in those terms too. And we also talk with him because he's trying to teach her tricks, and he keeps waiting too long to give the reinforcer. And I keep saying to him, if you don't give it right away, she's not going to link it up that's what it was for. Right. It's very interesting to be on the flip teaching him how to do those things.
That's awesome, yeah.
But kind of a related question that somebody has asked. They want to know how to generalize the skills learned from ABA session to the daily real world in a timely manner. Is it good to introduce many play dates opportunities to seek potential future friendships? So how do we all generalize these things that we learn to the real world?
That's right, and I think it's a natural process, and I think this parent is asking kind of, you know, one of the things we do is right after we work on teaching play activities or any social activities, we do actually ask the parents to try to invite peers over so that we can help generalize those things to normal life. And for this parent, what you'll see is that even though you thought you predicted stuff, a lot of things happen in the general environment that we're not prepared for. And when you see your child play, like let's say you've practiced a particular play routine and then you have peers there, things will go completely different than you expected. And that's great. That's not something to be disappointed in, because it allows you to list all the potential things that you didn't deal with, you know, like, oh yeah, what if there are two friends and they both prefer to play with each other? and then my child gets left out. Okay, well, this is an opportunity to then teach your child, A, how to engage with a group, B, how to not feel depressed about being left out for a few minutes, all those types of things, you know. So yeah, we have a very specific protocol, and I'm trying to, like, you know, just address this parents' issues. The way that we integrate, I mean, specific skills, we just generalize across people, across times, across environments. But social skills that go to a peer, like that are intended for the child with peers, we will generally work on a specific skill with the child one-on-one, so one adult to the child. Then we will actually bring one other child into the scenario, practice it with the two children so that the adult can be taken out, and then we will perhaps introduce a group of kids, or then introduce it in school. So there's kind of a step-by-step thing. You want to do it gradually so children can generalize. But the truth is, all these things that we learn in behavioral intervention are completely part of what we do on a daily basis.
And I have to say, for my part, one of the things that I noticed about CARD is that you guys talk about generalization on day one. When you're adding a new skill in, you have already planned for how you're going to generalize that skill before you initiate the lesson.
Oh, yeah.
And I took that kind of for granted. Generalization got talked about on a daily basis. And again, anytime something was added, how are we going to generalize this? It wasn't an afterthought. And I kind of took that for granted as, oh, that's an ABA thing, that everybody does that, until I would sit and talk with other moms, and they would talk about doing something in the home. And also, I will say that our CARD team pushed and prodded and cajoled and manipulated me, and would say to me, you know, we have to go to the grocery store today because we're working on something, and we need to generalize it. We need a play date today. I would be reluctant because I was still locked in my fear of, what if he misbehaves? What if we have the tantrum? What if I can't deal with it? You know, I mentally was in that place, and you guys did not allow me to stop my child from generalizing.
No, that's terrific, and I'm really glad to hear that. Because it's so important, and if you don't do that, the child sort of learns a series of things that aren't useful, and then they'll drop those things off. They just won't maintain them. So without generalization, behaviors won't maintain. Because they're useless. So, you know, you learn anything you learn, and if it's not applicable, that's why the very first thing we try to teach is requesting, manding, because that's the number one useful thing to a child, is to be able to get their needs met. And so, you know, everything you teach, it's important to make it functional and useful right away.
And is it something where if a parent has an ABA program and they're not hearing the word generalization, that they should ask and say, how are we planning for generalization?
They should be extremely alarmed if they're not hearing the word generalization. Generalization, acquisition, generalization, maintenance are part of everything you do in ABA.
Okay, so if it's not happening, this would be a big red flag.
Absolutely.
Okay. Great. And this is interesting because we've had this question a couple of different ways in the last couple of days, so I'm glad that somebody asked this. My question is, how do I get to be a BCBA? Not going to college because of two things. My city college, Appleton, Wisconsin, don't have a program for BCBA. What do you guys know about online program without taking SAT or CAT? And we've had many people writing in the last couple of days saying, okay, I've heard you use this expression, BCBA, thinking about going and doing this. How do I do it, and how long does it take, and is it worthwhile to do?
Yeah, I think it's worthwhile. There are some universities online programs that allow you to do this without the SAT or ACT, for instance. I think Florida Institute of Technology is one of them, FIT, and they're a good program. There's a number of online programs. I think St. Cloud has an online program. I'm not sure what the other ones are, but I know there's several. And people have to realize it's a master's level program. So it doesn't really matter what your bachelor's is in, because right now the BACB is not differentiating that, but it is a pretty heavy commitment for about 2 to 3 years after that. And so after your bachelor's, you apply, and then you're taking courses, and then in addition to these and the courses are generally, they're not about autism, they're about behavioral principles, right? And so what happens after that is you also have to do You have to take an exam, and before you can take the exam, you have to do what's called mentorship or supervision, and that's a pretty lengthy period. I'm not sure what the hours are right now because mine is so old. I've had it for a while, but I think it's something like 750 hours or something, and those are hours where you're actually working in the field. Now, not necessarily with autism. It could be in an organizational setting, and you're working with increasing the efficiency of employees, whatever. It's the application of behavioral principles, but there's someone supervising you, and that person is a BCBA.
Yeah.
So that person would then have contact with you on a weekly basis and go over your hours of work and so on, and then you have to pass an examination. And as I said, it's a pretty stringent series of requirements. They are also continuously adding to them. There's a lower level credential called the BCABA, which is Board Certified Associate Behavior Analyst. And that's a bachelor's level. That still does require some coursework and hours, but it's a lower level. And I think the BACB is coming out with a technician credential as well, which is yet the newest, lowest level, which is for undergraduate level people. I don't know when that's actually going to be out. Probably pretty soon, like within the next few months. And so it is completely possible. Now, is it worthwhile? I guess that depends on what you want it for.
Right.
But yeah, I mean, it's a very good career. There's a lot of people who are coming into this field because it provides them a very good career. It's very high paid right now because there's a huge demand for BCBAs. I'm not sure that it'll remain this way for the next 10 years, but it might.
But it appears there's a certain amount of job security if you are a BCBA at this point in time, that there are plenty of jobs.
Yeah, I would say so. I mean, we hire a lot of BCBAs, and yes, we put them through pretty intensive training for about 4 to 6 months, which is very, very, high cost for us as a company. But we do it because we find that our BCBAs have a very good understanding of basic principles, but they're young people and they haven't always had a chance to apply to kids with autism and some of our own stuff, card stuff, we have to teach them. So that takes a while, and we do a massive practicum period for them, with them. And so they get their we can also get people pre-exam BCBAs and just give them their supervision.
Right.
But having said that, yeah, I guess we are more hesitant to, we really work hard on training our BCBA folks because their credential is valuable, meaningful. It allows access to insurance coverage and those types of things.
Absolutely amazing. And so I hope that you'll further check that out if that's something you're interested in.
And anyone who wants more information on that should go on the BACB website.
Yes,
Behavior
absolutely.
Analysis Certification Board, BACB.org, I think.
Okay. We should let you take a break. I always forget to give you a break.
Sure.
We're going to take a break. You know that we're less than a week away from my shaving my head on Monday for our Compassion in Action. We're encouraging all of you to participate in our Compassion in Action. It can be any action that you want to take to do something nice for someone else, and we've continued to make little promos. So take a look at one of the new promos that we've done for Monday's head shaving and encouraging you to participate. We'll be right back after these messages. Welcome back to Autism Live. I hope you will join us on Monday. We'll be starting right at the top of the show with the head shaving, and all throughout the month of April, we are looking to showcase your acts of compassion. So please participate. Let us know what you're doing. If you belong to a group or an organization that is doing something special, we would really like to cover it here on the show. But right now, we're here with Dr. Doreen Granpeesheh and getting answers to a great many questions, which is very wonderful. And I appreciate your time.
My pleasure.
So we have more questions that have come in on the Facebook this week. Somebody wanted to know who to go to when nothing works medicine-wise for PMS/autism 10-year-old. Does anyone know who is leading in research to help with this? Very interesting that they have said that it's both PMS and autism for a 10-year-old. Mm-hmm.
Well, I mean, oh gosh, so you're looking for an endocrinologist who also has specialization in autism, which is very hard to find. I guess a lot of the MAPS physicians, they have different specialties, right? Mm-hmm. And then they come in and get trained for autism. A very dear friend of mine who's an immunologist in Louisiana, Dr. Jane Eldar, she, I think, is probably the person I would go to and ask about this situation. I don't know any. There are, of course, people who, OBGYNs and so on, who can also address hormonal issues within autism. But yeah, I think your best bet is still trying to find someone who is trained specifically either by MAPS or was a previous DAN physician, and they would be able to help a little bit more. It is tough. I would say you separate the two issues and deal with them as they are. I mean, autism is what it is, and you have to reduce challenging behaviors. PMS will contribute to anything, like the rest of us, and you perhaps want to treat it with medications like Midol and so on, and just help the child function, and keep in mind that it's a few days before a certain period of time every month.
Right.
That's going to be tough for them.
Devastating to start that as early as 10.
It's a tough one, yeah.
And I do want to say, too, because we talk from time to time about physicians, and you'll bring up physicians, and you might think to yourself, well, I live in New Jersey, so how am I going to get to this doctor? But a lot of times at the conventions, you can check and see which doctors are going to be there. And I know a lot of parents who go to the conventions specifically to have an opportunity to talk to the doctor. You can talk to the doctor beforehand and say, I'm going to be at the convention. Can I have an opportunity to meet with you?
Right.
There's much more access to these doctors than I think people realize.
Absolutely. And a lot of them actually have time. So I don't know where this family is, but if you're in the, let's say, south, then I would try to contact Dr. Eldar. If you're in the north, or like Chicago area, maybe Dr. Anju Usman is a favorite of mine. There's several in California, several on the East Coast as well. So there used to be a very good list of these physicians on the ARI website. I'm not sure if it's still there, but MAPS now might have their own list, because MAPS is just an additional sort of credentialing process that started.
Yeah, absolutely. And I mentioned that we had someone from South Africa on yesterday that was a previous ARI DAN doctor and is now about to get certified in MAPS. So if you missed that interview, it was fascinating, because she is a mom in South Africa and getting her MAPS certification. Okay, so another question that came in on Facebook this week: 20-something, high-functioning but not independent adult with autism. A lot of info for young adults with Asperger's, but I never see anything for adults that didn't quite get to recovery. Forgotten group. There have been more and more people talking about this, tweens, that they're somewhere in between. They're high functioning, but they haven't recovered. And that what do you do with that group? Yeah, I don't want to say that they're the forgotten group, because I know a lot of them, and we work with a lot of them, and that's kind of my favorite group, actually, because, well, it's not, I say that about all my groups. I love my kids, it doesn't matter. But I mean, I do love working with the very higher functioning teenagers and, going into adulthood, because their issues are usually just more cognitive issues. They're more psychological than behavioral issues, and it's kind of like trying to work with them and teach them to, it's just like normal stuff almost, social, understanding other people, understanding, being able to handle situations where they fail, being able to control your own anxieties and depression, and those types of issues. And I would say, for this parent, it really would be beneficial to enter the skills website and go to the high-level executive functioning, social skills, and cognitive lessons. You might not even have to actually use skills, but I'm just saying that's a really good resource, because some of the higher level stuff that's listed in there will really help you, like being able to understand, infer information from what you see, being able to understand other people's perspectives. I kind of feel like if you get a child to be able to see other people's perspectives and
Also to be able to like make those leaps between inferences, they generally start to pick up on everything else in their social environment.
Yeah.
Having said that, this is also the group that's the most prone to anxiety and depression because they are aware enough to suffer, I suppose, from social, deprivation, or like from other people not interacting with them. They're very aware of what goes on around them. And so that's what it becomes very important to help these individuals to gain some sense of, I guess, satisfaction or happiness in their own activities, in their own worlds, and so on. I just got an email from our good friend Nick, and I think that he did an interview with you guys. One of the things that I had wanted Nick to do, and he's very busy right now with college, but one of the things that I had thought of asking him to do was to actually have a series of segments where he talks about some of these difficult social things and how he's processing them.
Yeah.
And there's others of my kids as well, and perhaps what we should do is maybe have a show where, we're talking with them about some of the lessons they learned after therapy, and some of the struggles with, let's say, relationships. That seems to be a big one. But we have problems with relationships too. Sometimes I think my kids, my adult kids, who are really functioning great, and they get into a bind with something, and they're like, "This must be having something to do with me," and I'm like, honey, this is what we all go through. Everybody learns the process of relationship games, and all that sort of stuff. So
interesting that you should say that, because I believe that everyone should have to read through the executive functions curriculum of skills, and everyone could benefit from it.
Absolutely.
Whether you're a parent or you never met anybody on the autism spectrum, it's a benefit to you. And of course, we've talked before on our show about The Story of Luke, this really amazing film that had its Los Angeles premiere last night. And last week, one of the stars of it, Seth Green, was on the Conan O'Brien show. He showed a clip from the movie where one person with autism was explaining to another person with autism, showing them a man and a woman meeting at the water cooler, and he was describing all the things that were going on in the interaction, saying, now look how he makes eye contact with her, but he lowers his eyes after a certain amount of time, so he shows interest but not stalker interest. Look at how she's playing with her hair, and they go through great detail describing all the things that happen in that interaction, because he's saying this is what you need to learn.
Right.
And they came back from the clip, and Conan's response was, man, did I need you in high school.
Yeah, exactly.
Right? Because he could have benefited from that lesson.
That's right.
We all could.
That's right.
To have it decoded for us.
Absolutely. I mean, these are the things we learn. Like, so when you're a teenager and let's say you fall in love with someone and they don't respond, or, they're not interested, or whatever it is. And as a teenager, you go through this whole phase of like, oh my God, there must be something wrong with me, and then up and down and up and down. And then ultimately at some point in your life, hopefully sooner rather than later, you come to the conclusion that it really had nothing to do with you. And, you need to just be going down your path and doing your own thing, and the right person will come along. All of those things are just lessons of time, right? Otherwise, I mean, our teenagers wouldn't be acting crazy either.
Right,
exactly. Our teenagers go through everything. We all did.
Yes.
So these are just learning processes that we all have to go through, and I think it's harder for our kids because sometimes they have to learn the rules that are subtle, unwritten rules. But I mean, and as far as I'm concerned, you could read 500 books on social skills and it won't go into any of this, because this is just much later than social skills. This is very, very abstract little things that we're talking about. And as long as you've taught the child, like, that's why we teach all those basic things, like paying attention to facial expression. We're actually just making a game right now, an iPad, sort of an iTunes library game that has to do with not only recognizing facial expressions, but making them by adding the eyes and the mouth, and so that you can like get to see what different parts of your face how they change for different
Awesome.
facial expressions, right? But I mean, you learn those things, they won't necessarily generalize to the real environment, but they will with time.
Yeah, absolutely. Well, exciting information. I'm glad to know that you're working. I can't wait to see this app.
Yeah, it's
Sounds
kind
great.
of cool.
Okay, another question. This is a very interesting one. My child has terrible skin rashes. Is that related to autism?
Mm-hmm. It could be. You need to. Well, I mean, I don't want to say it could be related to autism. You know, scientifically, nothing is related to autism. So, although we know that a lot of our kids have lots of different medical issues.
Yeah.
So what might be happening with your child is yeast, fungal problems, and you should definitely have the skin rashes checked out. Now, here's the thing: when you if you go to a dermatologist, most likely they will just call it eczema and then give you creams or something, but which will kill the reaction, so you won't necessarily see it. So the rash should get better with things like cortisone, but that doesn't mean that you're dealing with what's causing it. What's causing it is very important, so you need to get allergy testing and rule out things that your child might be reacting to as an allergy, and then you also need to get blood testing or urine testing to look at organic acids. That would be a urine test. You need to figure out if your child has high levels of yeast, candida infection, and that is important because that does result in a rash.
Yeah.
It's like, what is it called? Ringworm, for instance, is a fungal rash. And so your body is reacting and you're kind of detoxifying or have high levels of yeast. And that can be treated with an antifungal medication, with some dietary changes, but it is very important. And at intake, I'll ask the parents, you know, did your child have, even all the way back to kids who have a high amount of diaper rash, for instance, or another indication is thrush, you know, and when your tongue gets yellow from white, and that's yeast as well. Or later on, a lot of people will get those types of infections. So it is important to deal with it.
Yeah,
for sure.
absolutely. Another great question that came in last week on the Facebook. I was wondering if you have any information for siblings of autistic children. They say that their child is only 4, and we want to make sure we do the right thing when explaining about his older brother's condition. Thank you so much.
Well, if the older brother is 4, is that right?
I think we don't know how old the older brother on the spectrum is, but the younger brother is 4, and it sounds like they're wanting to language it in some way for the 4-year-old to understand that his older brother is different.
I would, you know, and I would, right now I wouldn't label it as anything severe. Thank God so many kids now know the word autism, at least, or are aware of some of the things that go with autism. I wouldn't really go into too much detail. I would just say he has some problems learning language, or he has some problems giving eye contact, or whatever the symptoms are in the older sibling right now, because the older sibling will most likely change.
Yeah.
And as the older sibling is changing, I understand that probably the family at this point wants the younger sibling to have some understanding, because so that they would be less frustrated, perhaps, because perhaps I'm guessing that the younger sibling might be trying to interact. The older sibling isn't reciprocating. So you would want to explain that, no, this isn't, he's not doing it on purpose. He just has a hard time hearing stuff that you're saying, so I would take the specific scenarios that might be causing the younger sibling some distress and explain them better.
Awesome.
But I wouldn't necessarily go into giving a specific label.
Okay.
Another reason you might be wanting to give a label is if other kids have said the label and then the younger sibling's wondering, what does that mean?
Yeah.
And if that happens, again, I would explain, okay, this means he has a hard time with learning to speak, he has a hard time with making friends, he has a hard time really kind of paying attention to all the stuff that's around him. And then I would leave it at that for now, because the very young children have a hard time understanding these things anyway.
Yeah. Holly Robinson Peete has a book out too with her daughter that she wrote that's called My Brother Charlie.
Right.
That's from the point of view, it's a very young reader book that from the point of view of a girl who finds out that her twin brother.
Awesome.
And I don't know, I can't remember, and I'm sorry to say I can't remember whether they actually use the word autism, but it's about the sister dealing with the fact that sometimes her brother brother is different and that other kids react to him in a different way. That might maybe be an innocuous way to, read that with a child and not necessarily have a discussion about it, but they could potentially even ask questions. Are you into that kind of thing?
Oh, yeah, that's a great idea. I mean, and I don't know of the book. But it's awesome if there are books out there like that, because I often am very concerned for siblings. I mean, it's hard enough to, if you have multiple children in a family, to make sure everybody gets equal coverage, you know? But when you have a child with autism, you necessarily have to give that child so much attention. And then I often find that our siblings turn out to be, the best, just unbelievably patient, giving people, but at the same time they kind of are forced to grow up a little too fast. It's kind of like they have to take on responsibility, and then I worry about them because later in life that might show up for them. So it's just important for parents, as overwhelmed as we all are, to try to make sure that you have your time alone with the siblings and spend time with the sibling as well.
And I have to, since you brought that up, I have to give a shout out to, we talk sometimes about the Autism Research Group here, and they have a program that they've been working on called Connection, and it's just for siblings. Things for them to do to get together with other siblings that have nothing to do with, other than the fact that they all share that in common, but they're not having to take care of their siblings. They're, fun like bowling dates or things that they go. And I know there's one here in Los Angeles, and they're looking at starting some other groups. You can find out more information about that by going to autismresearchgroup.org. So great Connection. There's a tab under resources for it. It is an awesome thing. Okay, here is a loaded question. I don't know why when we get to the end I always ask you the ones that really you could spend a month on. Why do some kids get a lot better and other kids only get a little better?
Oh, gosh, that is a loaded question, and I could talk for a while. How much time do I have? About 4 minutes?
Yeah, 4 minutes.
So I think there's a number of elements that contribute to how our kids end up doing. Obviously, the kids start out at different levels of functioning. So and I think that has more to do with the time that they were affected by whatever started to produce the symptoms of autism. So, how I always look at autism is that there's the genetic predisposition, which really more and more means nothing. But some environmental factor triggers the symptoms of autism when it sort of interacts with the genetic predisposition. And if that environmental factor, the earlier that happens, I guess the more the severity of autism is what I'm saying. So like if you are receiving toxicity from mom while in utero, then it's likely that you will have more delays in development than if you're exposed at the age of 3. If you're exposed to some very serious toxic elements that your body can't get rid of twice in your life, then you're more severe than if it was once. Those types of things. So the severity level obviously plays a part in it. And not all of the kids just actually are able to come out of it completely just because there are too many things going on. And I find that when a child has problems in regulating, like in receiving information, both visually and auditorily. And I've talked about this a lot, where I feel like our kids have a hard time with how they see things, their perception of objects, and also some of the actual core visual things like tracking and binocularity and so on. But they also have issues with how they hear things. And as you know, a lot of our kids say they hear the sound of language, for instance, is the lowest sound, and it's the hardest one to pick up on, and so on. So if you have a combination of receiving information auditorily and visually, and both are impaired, then it's the hardest for those children to learn, because they're having a hard time learning. How else are you going to receive information? So the sensory problems, I suppose, impact how you do overall. The age at which you start has a huge impact. Like, let's say if you start at age 2, you have much more time to learn all the things that you didn't learn than if you start at age 5.
Right.
The intensity of doing ABA, so this is one of the things I really get upset about, is when A high-functioning child at age 2, someone misleads the family and says, just do 10 hours, and that's just such a wasted time. So my belief system is you hit it early, you hit it intensively, and that gives your child the best chance. Now, that's on the behavioral. On everything else, obviously, no matter what age your child is, you need to be looking at any medical symptoms that are not that are detrimental to normal functioning. So whether the child is not eating properly, is allergic to half the food they're eating, is sensitive, has rashes, let's say has major gastrointestinal problems, diarrhea, constipation, just bloating, is not sleeping, all of those things need to be dealt with and cannot be ignored.
Right.
They need to be fixed as much as possible so that the child's physiology is good. And so if you're dealing with the medical stuff, if you're doing the appropriate interventions and you're doing intensive behavioral intervention, then you have the best possible chance of overcoming your symptoms if you have a good behavioral program. If you, let's say, ignore some of the medical stuff, if you do minimal hours, if you do poor quality behavioral intervention, if you start very late, if you don't address the sensory needs of the child, then all of those things will have a negative impact on how your child does. Having said that, I'm not sure that I would say the majority by far of my children who do everything the way they're supposed to do it do benefit and do come very close to completely overcoming.
Right.
But it's a lot of elements to keep control over. And then finally, the other thing is that you really do need a pretty dedicated family. Parents have to be very much on board and recognize that this is a couple of years of pretty hard work, and bringing all of those things together is tough.
It absolutely.
Yeah.
I hear that and I feel overwhelmed.
Exactly.
And yet, and we didn't do it perfectly. There are still things that we need to do, and yet we've had such tremendous progress. And even after we've gone through it, I hear all that and I go, oh, there's so much to be done. But I would remind everybody that you start in one place, you prioritize, and you figure out, okay, this is what I need to do today,
right?
Or this is what I need to do in this hour,
right? And
you get the ball rolling and things happen. And
absolutely.
And I think for sure aligning yourself with really quality ABA, and if possible, having it be the Center for Autism and Related Disorders, because there were times when I would have missed other things, but you guys pushed me and didn't let me retreat into the hole that I wanted to go into as a person.
I mean, it is tough though, Shannon. I mean, and as I just went through the list, it gave me some other ideas, but it really is a lot of different variables, and being able to make sure that all these variables interact with each other perfectly for your child is really, really hard.
Yeah, it is. So don't think you can do it on your own.
Yeah, and don't ever waste any time feeling bad about it or guilty about it. I know a lot of parents do, and we all do, right?
Yeah, absolutely.
But the truth is, all you can do is your best.
Yeah, and I think the thing that I remind myself on a daily basis is the time that you spend beating yourself up over what didn't happen yesterday is another period of time that you could have been making it happen today.
It's a negative period of time for sure.
Yeah.
And it's not healthy for you. To be experiencing those.
Well, that's a whole other show.
Right.
that is a whole other show.
It is.
Absolutely, because of for parents dealing with all the negative feelings about whether you're getting it done.
Right.
Because there's so much to do. I don't know a single parent who feels like they can or did get it all done.
Right.
And there is that thing sometimes that parents don't want to talk to other parents because they're like, oh, they're one of those parents that's getting it done and I'm not. I have guilt about that, so I'm not going to ask the question that could help my child.
Right.
We could talk about all that, and we will another time.